Today, I'll discuss a crucial topic many will encounter in their lives: hair loss, also known as alopecia. Hair loss significantly impacts both men's and women's self-esteem. Thus, it's vital to act immediately upon noticing the first signs of hair loss to determine its cause and start appropriate treatments. Unfortunately, many first try various over-the-counter remedies and shampoos, delaying seeking medical help until later stages. This video covers the primary causes of hair loss, and a subsequent video will address potential treatments. For consultations and treatments, you can visit my clinic, Dr. Contour Clinic in Antwerp, Belgium. Find the link in the description below. So there are three main categories of alopecia. 1. The most common non-scarring alopecia, where hair follicles remain intact and the damage isn't permanent, allowing for the potential regrowth of hair. This category includes conditions like telogen effluvium, androgenetic alopecia, also known as male and female pattern baldness, and alopecia areata. 2. Then there's scarring alopecia, where lost hair follicles are destroyed and replaced with scar tissue, preventing hair regrowth. This form is permanent but much rarer than non-scarring alopecia, offering treatments for potential hair regrowth, seen in conditions like discoid, lupus erythematosus. 3. Lastly, hair shaft abnormalities not characterized by hair falling out, but by structural abnormalities in the hair shaft, making it more prone to breaking. Often perceived as hair loss, this actually represents higher hair breakage. The two most common signs of hair loss are shedding and thinning. Shedding often becomes noticeable during showering, as it seems like hair falls out everywhere. Many also find they need to vacuum their homes more frequently due to shedding hair. And thinning becomes apparent over time through increased visibility of the scalp. For instance, when tying hair into a ponytail, people may need to wrap the elastic band more times than before, and buns may appear to have less volume. Most people only notice thinning after losing about 50% of their hair, highlighting the importance of taking action as soon as hair appears to be thinning. Various factors can cause hair loss, including genetics, medication, environmental factors, deficiencies in minerals or vitamins, stress, and more. This video will delve deeper into the most common causes of hair loss. It's normal to lose about 50 to 200 hairs daily, as hair continuously cycles through phases of growth and shedding. Hair loss is considered abnormal when shedding and thinning significantly deviate from what is normal for you. Long hair also makes hair loss more noticeable. The most common type of hair loss is androgenetic alopecia, also known as male or female pattern baldness. The cause can be genetic or hormonal. There is a difference in how this manifests in men and women. In men, we often see a receding hairline and thinning hair on the crown, while in women, the parting on the scalp widens with visible thinning hair, especially in the central part of the scalp. It's also important to know that hair loss can come from both sides of the family. There are many misconceptions, such as only needing to look at your maternal grandfather to know if you will experience this, or that hair loss skips a generation. No, you should look at every family member. Do your sisters, brothers, father, or mother have thin hair? They don't need to be completely bald to have alopecia. People sometimes say,
"My father has thinning hair, but he's in his 70s, so that's normal."
But hair thinning at any age cannot simply be attributed to age. If someone in your family has thin hair, you could also have thin hair. And you can even be the first person in your family with androgenetic alopecia. Our DNA is passed down from generation to generation, and there can always be small mutations. Someone has to be the first, and that could be you. Androgenetic alopecia can occur at any time in your life, from teenage years to later in life. It's a misconception that it starts in men in their 40s and in women from menopause. It can also start in the 20s and 30s. But of course, it's always necessary to first look at whether your hair loss could be due to other causes before you can say you have androgenetic alopecia. So it's important to know that hair loss is not just a condition for older people. Finally, it's also important to mention that female pattern hair loss in women can also be caused by polycystic ovary syndrome, PCOS. This must be excluded. So if you have irregular or absent menstruation, excessive hair growth on the face, lower abdomen or chest, back, acne, and possible weight gain, it's important to further investigate this with a gynecologist. The next common cause of hair loss is telogen effluvium, often known as stress-induced hair loss. Hairs follow a certain cycle, so usually the vast majority of the hairs on the scalp are in the anagen phase, which is the growth phase of your hair. A small percentage of the hair is in the telogen phase, or the resting phase, and the hair remains in the telogen phase for a while until they fall out. But now, what happens when your body experiences an extreme stressor, either physically or emotionally, and then an abnormal number of hairs transition from the anagen or growth phase of the hair to the telogen or the resting phase of the hair. When more hairs are in the resting phase, it means that ultimately many more hairs will fall out at the same time, and when that happens, you have increased hair loss, and that is telogen effluvium. The telogen or resting phase lasts about 3 months on average, but can vary somewhat. But there is a delay in the time elapsed, since the specific stressor has affected the body, until when the hair actually falls out. So when I, as a cosmetic doctor, evaluate someone for telogen effluvium, I always look for significant changes in emotional or physical states that have occurred in the past 6 months. So we need to look back for a while. Some of the most common triggers for telogen effluvium are weight changes, the well-known crash diet, intermittent fasting, recent surgeries or illnesses, post-pregnancy, so many women lose a lot of hair a few months after giving birth, work-related stress, death of a loved one, and so forth. But if you have hair loss due to telogen effluvium caused by a stressor, how long will your hair fall out? Well, this can vary greatly. It can take several months, but also up to a year. As long as the stressor persists, the telogen effluvium will continue. And then there is another common condition that causes hair loss: alopecia areata. Alopecia areata, or spot baldness, is an autoimmune disease where the immune system attacks the hair follicles, leading to hair loss. This results in one or more round bald patches on the scalp or elsewhere on the body. It is the condition that Jada Smith has suffered from. The condition is quite common. About 1 in 50 people will experience it at some point in their lives. In some patients, another autoimmune disease is found, or there is a family history of alopecia areata. It can be triggered by stress and infections, among other factors. This condition is mainly treated with corticosteroids, often through injections into the scalp. Additionally, various medical conditions can cause hair loss, including lupus epidermidis, previously mentioned in relation to androgenetic alopecia and female pattern baldness, hypothyroidism, a condition of the thyroid gland where too little thyroid hormone is produced, vitamin D deficiency, and iron deficiency. This latter issue is common in young women with heavy periods, leading to a lack of iron. Iron deficiency can cause not only fatigue but also hair loss. And therefore, it is important to have your iron levels checked and take iron supplements if necessary. Deficiencies in biotin and zinc should also be investigated, as these deficiencies can contribute to hair loss. It is crucial to exclude other medical conditions so that they can be adequately treated. When medical conditions are well controlled or treated, hair loss often disappears. The use of certain medications is also a significant cause of increasing hair loss. It is well known that chemotherapy leads to hair loss, but blood thinners, some antidepressants, medications for heart problems and high blood pressure, certain contraceptives, epilepsy medications, and even common NSAIDs like ibuprofen and aspirin can cause hair loss. Consultation with a doctor is essential if you suspect that a medication is causing hair loss. And then there's also hair loss related to a specific way of styling your hair, caused by constant traction on the hair roots due to very tight ponytails, buns, or even wearing extensions. I don't like to say it, but the prolonged tension on the hair follicles can lead to damage and even permanent hair loss if the situation is not changed. Therefore, for all women who love tight ponytails, buns, or extensions, it's important to vary these hairstyles and avoid extreme tension on the hair. Lastly, I want to discuss a psychological condition that can cause hair loss: trichotillomania. With trichotillomania, someone has an irresistible urge to pull out their own hair. This condition is often caused by stress or anxiety and can be seen as a way to cope with negative or uncomfortable feelings. In patients with this condition, we often see hairs in various stages of regrowth. This is because the hairs are pulled out at different times, resulting in an uneven pattern of hair lengths in the affected areas. So, this was a brief summary and explanation of the most common causes of hair loss. I want to emphasize that this video cannot replace a consultation and is purely for informational purposes. If you are experiencing hair loss, it's important to consult a doctor specializing in hair loss who can help determine the cause of your hair loss and potentially develop a good treatment plan. As a doctor, I can help with certain types of hair loss to develop a good treatment plan, so you can also book a consultation on my website for this. If you found this video interesting, please give it a thumbs up and subscribe to my channel. Goodbye!